This case of a diffuse thyroid process is interesting for two reasons. Hypoechoic lobules are visible within the gland. The best term for this phenomenon is lymphoid lobules, meaning lobules containing lymphocytes. Terms such as pseudonodules, micronodules, giraffe skin, and others are empirical, erroneous, and outdated. The term lymphoid lobules has a pathogenic basis and has already been published in several articles by Dr. Ushakov. The rest of the gland contains acyhoic tissue, which should be described in the ultrasound protocol as macrostructurally sound tissue. Note that acyhoic tissue accounts for over 95% of the gland. Therefore, the thyroid gland is potentially capable of supplying hormones to the body. In powered Doppler mode, at basic settings, blood flow intensity is reduced. The patient is not taking any medications, and blood tests show euthyroidism and normal thyroid hormone levels. All of this indicates sufficient hormone production capacity of the thyroid gland. It is possible that the changes in this group of lobules occurred due to the specific overstrain in the relatively recent past, likely about a year ago or either. This overstrain was accompanied by an increase in hormone production to overcome unfavorable conditions. Some lobules received more stimuli via the autonomic nervous system than others. As a result, the tissue of these lobules become significantly depleted. Cell and follicle destruction occurred. Lymphocytic infiltration of the lobules became compensatory, aimed at recycling damaged tissue elements and promoting interlobular regeneration under favorable conditions. You can learn more about interlobular regeneration in our dedicated article. Please note that you should read the correct version of the article. This and other articles on the thyroid regeneration explain that regeneration doesn't affect thyroid hormonal levels.